Well, good afternoon, everyone, and thank you for joining us today for the Living Room Leadership webinar. We definitely know how valuable your time is right now, and we are very grateful that you are choosing to spend the next hour with us as we navigate this new world of remote work together. I am Katie Arens, Director of Customer Accounts and Mobile Health Solutions for LIFE EMS Ambulance here in West Michigan. And today I am joined by Mr. Frank Gresh, Chief Information Officer for EMSA, AKA the IT extraordinaire, and the ever-talented Mr. Scott Moore of Moore EMS Consulting. As a reminder, the Q&A box is located at the bottom of your screen, so you can use this to ask questions at any time. We will definitely do our best to answer as we are able, either via chat or actually during the live streaming. This webinar is intended to be interactive, so please, if you have ideas to share on this topic being discussed, or if you want to share what's working for your organization, you can do so also using the Q&A feature. I'm by no means an expert on this topic. Definitely the goal today is to just share some of the best practices that we've encountered in the past and present regarding remote workforce. I think it's very safe to say that this new work environment we're in, both for our frontline workers, but also our remote workers, it's a journey right now. Obviously, we don't know what the destination looks like, so not knowing where we are going or when we may get there is definitely contributing to the fear, grief, and anxiety I think that most are feeling these days. So we as an industry are typically built on our data. We can predict with good confidence what our volume is going to be in 2 weeks. And from there, we can usually predict what our cash flow is going to be. And that's just not the case right now. So you've seen that in Michigan, we've been hit hard, but the same preparations and feelings, they're happening everywhere, regardless of the numbers you're seeing reported by your state or region. There's very little control right now. So how can we try to foster a productive environment at home amidst a pandemic and chaos? And that's really the topic for today. I'm coming to you from my living room. My children have been bribed. My dogs have their, I don't even know how many bone of the week to try and get some quiet time. So we'll see how this goes. But first and foremost, we want to just extend a huge thank you to all of our first responders who are working the countless hours right now, selflessly on the front lines in this fight against COVID-19. A huge thanks to all of you who have been joining the AAA and bringing awareness to EMS, either through your social media posts, your local news sources, lobbying. Every little bit counts right now, and we need to remember that no ask is too big when it comes to protecting our people and our reimbursement for the work that you guys do each day. So as always, we have our disclaimer here. So I am not an attorney. The American Ambulance Association, its consultants and speakers do not provide legal, financial, or accounting advice. This material is for informational purposes only and should not be relied upon for legal, financial, or accounting advice. You should always consult with your own legal or accounting professional. So what are we going to talk about today? Just a quick agenda. How did we get here? Help identify who is eligible for remote work, policies and procedures, designing metrics and expectations amongst chaos. How can you stay connected, and then feedback for results. And we'll also talk about some IT infrastructure and compliance as well. So how did we get here? For many of you, remote work really isn't a new concept. We were fortunate at our organization. Actually, I had about 40% of my billing team was already working remote, either full-time or part-time in some capacity before COVID. I believe in order to stay competitive and appealing for candidates and keeping retention high, remote work has to be some sort of an option in an office setting environment. But for us, moving all of our team fully remote wasn't really thought of like many pre-COVID, but it did happen, and it happened on a Tuesday at roughly 10:40 a.m. It wasn't a thought anymore. It became my reality. And we had to move our whole office to a remote work environment by the end of the day. And, suddenly I've turned into Oprah, and everyone, you get a thin client, and you get a thin client, and you get 2 monitors. And our team members are looking at me with just straight confusion. Like, I thought I couldn't do my job at home. And are you crazy? My kids are there. I don't know how to use a VPN. The questions just went on and on. But we started that next day with nearly everyone remote, thanks to our unsung heroes, our IT department. And we sent our folks home on March 17th. We wanted to limit exposure and risk ahead of any executive orders that were going to come in place, even if they didn't. So our stay-at-home orders here in Michigan were put in place on March 24th. So we were prepared ahead of that time, and we will continue at this point until it's deemed safe and sound to move some of our folks back in the office. And again, I want to emphasize that some, as we have found obviously new opportunities through this, and we hope you do as well. So next slide. So how do you identify who's eligible for remote work? And of your remote workers, who's still considered essential? Because it may not be that everyone can work from home. And this is really going to be dependent on your organization. Are you still receiving all your payments in the office via mail? Do you have to make a bank run? Do you mail your statements? This isn't work that can be stalled to keep normal business operations. So these folks are going to be considered essential to your daily operations. But how and when they do their work, you may be able to adjust. If you have multiple people handling processes that have to be done in the office, can you consolidate these to one? Or can you split in office days? So for us, for instance, we were able to move all but one of our admin assistants fully remote, but we chose to limit her exposure out of the home, and we consolidated her work from 5 to 3 days a week. And we worked with our operations department and other leadership to cover the days she's not there to lock up any of the mail that may come in. Any mail that comes in is being scanned then to the appropriate associate for follow-up. So there's no hand passing of that at this time. So this also might be a good time to look at outsourcing, maybe with a clearinghouse or a lockbox vendor, to really help limit the volume of mail that's coming and going out of the office. Policies and procedures. Next slide. Thank you. Policies and procedures. So, Frank's going to talk a little bit more about IT. But you do definitely want to make sure that you have some policies and procedures set in place so that there are clear expectations. Cost sharing, what are they going to be responsible for paying for? Your HIPAA and privacy agreements need to cover your remote folks, making sure that they're not sharing equipment, what's appropriate, Wi-Fi usage, and then equipment agreements should definitely cover you from a standpoint of who's responsible for damage and loss, who has what equipment, so keeping track. Katie has 2 monitors, and Katie has a thin client, and Katie also has a VPN phone. You should be keeping track of that. And then also checking with your, liability and work comp carriers. And Frank and Scott will cover some of this more in detail in a bit. So how do you design, reasonable metrics? So, understanding that in today's world, your team has a lot going on, and that's a good reason to reconsider what productivity means right now. But at the end of the day, the work still needs to get done. So how do you design metrics for performance in a remote work environment amongst chaos? Well, you first need to assess what your customers and your patients' needs are, including your own associates. When do you need to have phone coverage or support available for these people? These are obviously going to be hard stop work hours, but really outside of these hours, most of our work that we do can be done at any time of the day, either through email, e-faxing, or other online resources we have. For each associate, this isn't going to be a one-size-fits-all approach anymore. And I really believe that that's where the win of remote work lies. You have to throw out the 8 to 5 schedule concept completely. If you try to force that in this situation, you won't get the results that remote work can really produce. Work towards a schedule and a workload that works best for your associate, and you will see that their productivity increases over time if you give them the tools they need. But you're going to want to take some things into consideration emphasizing again that these situations are changing day to day. So you want to continue to reevaluate this on a short-term basis. But some things to consider are, what is their home office setup? Going home with no notice didn't really allow anyone time to prepare. So where are they working? And, are they working in their bedroom? Are they working at a kitchen table? Do they have an office? That can impact the work they do and at what times they do it. Are they in flight or fight because of the certain situation at home? Is someone sick? Have they experienced a loss? Is their spouse now laid off? I think it's just very important to recognize that in leadership positions, this doesn't turn us into licensed psychologists or marital counselors or attorneys or anything of that like. And it's really important that, you lean on your resources when someone comes to you when they're in crisis mode. We have an employee assistance program that we can refer our associates to for help. And so it's really up to us to take the information and provide the resource that can help them. And then with that information they're giving you, you need to look at, can you flex with your expectations for the time being? Same thing with, are they wearing multiple hats? Are they working full time? Also trying to be teacher, main breadwinner, homemaker, etc. What are their schedule needs? Is their spouse working from home from 6 to 2, so they need to parent during that time? Can you offer them a later shift? In their home office, if their home office or their current home life isn't really conducive to the normal work they do, can you flex with them for the time being? So maybe they can do something else short term until their situation changes. But you have to make sure that you are always documenting these discussions, that you're documenting these expectations. So defining expectations. So maybe now you understand what their situation is a little bit better, but how do you know what they should be doing? In the world of EMS, we report most everything by time, minute or hour. So you have your response times, your UHUs, your turnaround times in the operations world. And then when you get into billing, we talk about pre-bills per hour, follow-up notes per hour, verifications per hour. But for my team, I found right now we're more successful when we're sharing metrics for what we expect to get done by that week and by that month. So knowing that each day may not be their best right now, but at the end of the week, did they reach their goal? And if they didn't, did they improve from the week prior? Right now, work is really all that people have a sense of control over. This is what they know, and they are leaning into their work more than ever now, because then this is comfortable for them. So if they're able to be fully present because they have the right schedule in place, they have the right equipment to do so, then they will show up. If they're failing week after week, even with coaching, you can dig deeper at that point to look for opportunities in their by hour or day output, to see maybe if there's an adjustment that needs to be done. Maybe they're not productive in the morning, they're more productive at night. And again, that's what's so beautiful about remote work, is that you can adjust that. But for now, reduce your expectation at first, continue to evaluate, and then recalculate as they find their way and communicate that expectation and progression. Ideally, your team is working at different periods of the day, but this can also create a challenge, right? Because, they don't have supervision. They don't know when you're available. There's no open door. So because you're not there, they may not be asking for direction. They may not be asking for questions. But I have what I call a snack drawer. And this is a folder in our billing drive that our team is able to access at any time. In it, I place reports that need to be worked or reviewed, following the rule of threes. So it has to be less than 3 pages worth of trips, and it can't require any more than 3 bullet points of instructions. Otherwise, there needs to be a conversation at that point of, what's the expectation or what needs to happen there. And that's not what the snack drawer concept's intended for. The snack drawer gives them work to do when they may not know what do they need to be doing next, or they get stuck on the current work that they're doing. Schedules, so schedule expectations need to be very, very clear. If they need to work 6 a to 2 p.m. right now, then you need to document this. If they need to work split shifts right now, you can do that and accommodate that, that's okay, but make sure the expectation is documented for your file, for scheduling an HR file. It's very important that you make sure break schedules, lunches, and active work hours are communicated to the whole team, because remember, they can't see each other and you don't want assumptions to affect your culture possibly negatively. So it's very important your associates understand that while they are working at home, they're not always working at home. So, emails, phone calls, etc., that all that stuff doesn't need to be answered and shouldn't be answered off the clock to ensure you don't get into any wage or labor law issues. And I know Scott will chime in and talk about this a little bit more in a bit. So how do you collect right now? What should you focus your work on? What should you focus your team on? So on the next slide, how do you collect in a crisis? So, focus on your cash flow right now. If your days to bill's been behind, they're going to quickly catch up, because unfortunately, one, most are experiencing that volumes are down, and two, people will be more productive at home. So know what your volumes are day by day, so you can then adjust your team's focus accordingly. You definitely don't want a coder slowing down their production, because when they pull up their report, they only see, oh, I only have to do X number of trips, and 2 weeks ago it was double that, or whatever it may be. Think about reassigning work, going after that low-hanging fruit. Don't go after your payers right now that have a quick turnaround time. So facilities, contracted payers. This is not a payer who, I don't want to name names, but we all know who they are. And it's where you call, you spend 25 minutes on hold, you status one claim, they tell you to wait 45 days to allow it to reprocess. And what do you have to do? I mean, you have to just turn around and call them again on day 46 because nothing's happened. So not only will you not see your money in 30 days when you're going to need it, but honestly, who wants to inflict that amount of additional pain and frustration on their team right now? I mean, just don't add to that stress. So don't get stuck in the 90-day rule. So you'll hear a lot often, KPIs surrounding the aging after 90 days. But in my opinion, this really isn't a one size fits all for all, different types of payers. It's going to be dependent on your region. Look at your aging by schedules and events. When did you submit that claim? Has it been 30 days? If it has, and you haven't heard from this payer, call and status that claim. Right now, it's important to remember that this pandemic doesn't mean payers don't have to pay us. It doesn't mean that they don't have to still follow clean claim rules or process appeals timely accordingly to their policies. So, we've called on claims on day 35, and we've found that batch that we thought went through, it didn't actually go through. And we were able to resubmit that whole batch for processing on day 35 versus waiting till day 60 or waiting till day 90. So the older the claim, the unlikely you're not going to collect. So right now, don't start calling on claims that are 180 days old. Focus on where you're more likely to collect. And this work will still need to get done, but ideally, the work that you're doing today will hopefully pay off in 30 to 45 days when your cash flow will need that additional padding. Performance metrics. So, this is really dependent on your organization, your systems. Do you partner with, do you outsource certain things? So for us, performance metrics are going to depend on the payer that our folks are working on for follow-up. Someone working for us on a contracted commercial payer that has a web portal, they can typically touch 50 claims a day, but someone who's forced to call on every single claim, I mean, their output is going to be probably closer to half of that. So, and don't get stuck in it's always been that way. Right now, everyone is forced, everyone's being challenged to kind of look at how they're doing things, and you should capitalize on that. So for us, we were mailing our facility invoices still, more often than not every week via snail mail. And when I had our team start calling these places over the last several weeks, we found we're able to get email addresses, fax numbers where we can send secure email and faxes. And so now instead of snail mail, these facilities are ecstatic because in turn, they're not sorting through mounds of paper that they just scan to their AP anyways. And now they can electronically approve and send off quicker, resulting in, faster payment. So just don't get comfortable and become complacent. Continue to reevaluate, continue to, recalculate, and continue to recommunicate where your focus should be weekly. So how do you stay connected? You should be engaging with your team no less than 3 times a day in some capacity, formally or informally. This is so very important in a remote work setting, as they can't see you again, or that your office door is open. So this doesn't have to be a full-blown sit-down meeting. Simple polls and surveys, will show that you're still there, and it will also show that their peers are there. It helps kind of just create that culture of, it's okay, today's not a good day, tomorrow will be better. But we're all in this together. Don't make email your main source of communication. Instant messenger chat rooms, they allow for quick updates. And then they also allow for your break room water cooler conversations to take place. So you do need to make sure that your HIPAA, your privacy policies are very clear on what information can be shared or discussed on these platforms. So this is intended for, light conversations. So we can be serious about our work, but still have fun. And we've started incorporating our associates, animals and kids into the mix. There's, jokes of the day, recipes, and that kind of stuff. So when it comes to actual formal meetings, video conferencing, is going to be your best bet. And so for us, we have a kickoff meeting on Mondays at 9, and we have a wind down meeting on Fridays at 9. And these are no more than 10 minutes long, but they set the tone for the week. And we talk about what goals we need to meet, what wins we can celebrate, and then any other overall department announcements and updates. So never, ever cancel a meeting. Even if you don't have any agenda items, you still need to hold these meetings. Sometimes not having an agenda, I found, actually allows for the best conversations, and also people, they're looking for that connection right now with their peers more than ever. So don't ever cancel a meeting. We have weekly interdepartment meetings with each group to discuss specific processes or opportunities that, we need to go through. And those are more formal. I get ready every day. I show up. I am always ready to be video present for my meetings so that my associates can see that I'm there, that I'm leaning in. And that they also know that I expect them to be seen. So being able to see them, then that they're engaged, that they're listening, so that we can be productive and they're not scrolling on their phone or working on something else while others are talking. Give grace for technology issues, but don't let this become a regular excuse. Make sure they know how to troubleshoot for next time. So, you don't have the same person who's missing meeting after meeting because they can't figure out how to get logged in. So have those conversations, and, do not surprise anyone with last minute meetings right now. Remember, our folks, they're working at all different times of the day. They're juggling school conference calls, nap schedules, whatever it is that's thrown in their lap. So the structured calendar is so very important. That's kind of really the only thing people have control over. So just be mindful and courteous of that. And then always follow up your meetings with an email so that, discussions and assignments are clearly communicated, and then you have that documentation to fall back on if needed. Feedback. So it's so important now for just to get results and keep that retention high. So ask for feedback and give feedback every week. They need to know that you see them and that you see their work. So productivity is going to be much higher when it's consistently measured and it's consistently communicated. If they become disengaged, you will not get the level of work out of them that they're capable of producing and that we've seen. So This doesn't have to be formal, but it should be a document or discussion of some type. For us, we have what we call a Take 5 reflection report. They send this to their supervisor every week. In it, they tell us what they've worked on. They self-report their own productivity. We ask what went well for them, what do they need help with, and the most important question of all is we ask, do you understand what your role is right now? And do you understand where you should be focusing your efforts? And this is really their chance to say, I have no clue what I should be doing. Help me. Just today I was reading one of my associates' reflections, and she said, I need more work to keep me busy. Work is what's keeping me sane right now. And it was like, wow, I don't think I've ever heard that before. There's an opportunity. So done and done, we will get you more work. And, maybe it's time for them to tell you if they need more training. Do they need 2 monitors after all, or do they just need to talk? All right, so I'm actually going to turn it over now to Mr. Frank Gresh, and he's going to go over some IT best practices.
Well, thanks, Katie. Glad to be on the call with everybody this afternoon. I wanted to kind of start off my remarks this afternoon with what I like to do quite frequently, which is manage expectations. As probably many of you, as we moved into this period of needing to move folks home and begin this working completely different than any way that we had ever done in the past, you're like, oh my gosh, there's no way we can do this. And so in this case, you don't really have a choice anymore. So that's one of those expectations is that, you're just going to have to do it. You can't afford to not do it. And so I wanted to talk about some of the initial expectations strictly from an IT perspective. First and foremost, most likely you are not going to be able to do this for free. It's like I can't pull this out of my little box of cables that I have in the closet and make the line long enough to have everybody work from home. You're going to have to do a little bit of investing, whether that's in remote access technologies, whether that's in virtualization, a variety of different things. But most likely you're not going to be able to do this for free. And the next thing is you can just put out any thought process that you had that it's going to be like business as usual, because this is no longer going to be the way that we've always done it. And I think, Katie did a great job of kind of starting everybody to wrap their heads around the fact that we're doing this, and we're going to have to find ways to do it. And it's going to make you uncomfortable. I went through several stages of grief as we went through this. It took me about 24 hours to come to terms with, yeah, we're going to have to do this. We're going to make it work. We can do it. It's just going to be significantly different. And then what I'm going to have to do to make it work. Absolutely want to evaluate risk versus reward. So yeah, doing these things from a cybersecurity and from an IT perspective is risky. But what things can you do to manage that risk? And I'm going to talk about that here in just a little bit. And one of the key things is flexibility. And I mentioned this both for my own expectations, my team's expectations, but also our entire team members that work in the administrative and in billing roles. That's one of the first things we said. We had a big video conference in our 2 boardrooms the day before we issued the everybody stay home, we're going to work from home order. And I set some expectations pretty clearly up front with everybody. And the first thing I said is, it is not going to be perfect on day one. We are going to make some mistakes. The IT folks are going to make some mistakes. We're going to have to kind of figure things out as we go. It's not going to be perfect. And so we're learning to be flexible. I asked them to also learn to be flexible with us. And surprisingly enough, and folks get it. I mean, they get that we are in an extraordinary period right now. But I didn't have one single negative interaction at all between our IT team members who went out to install the equipment at people's homes and work with them, and the billing staff or anybody at all. Everybody was absolutely flexible. Like, what can we do to help? How can we do this? And I think so setting that expectation right up front about being flexible and not expecting it to be perfect on day one was really the right way to kind of frame these things up, and to get people comfortable with moving forward. So then you kind of move into, okay, so I know I can do the right thing. How do I know that I'm actually going to be doing the right thing on the next slide? So what are you doing to limit your exposure? What have you done to assess your risk and begin to limit your exposure? Well, one of the biggest things right off the bat is you really, really need to limit the use of personal devices. And I know in some cases that means you got to buy more computers, or you're doing things with laptops, stuff that you hadn't normally planned to do. But I would strongly recommend that you provide the equipment for your folks to use, because if you don't, you have a lot less control over things like that. If you absolutely have to use personal devices, and I get that our entire ecosystem of EMS providers out there is very small to very large and everything in between. And in some cases, you might be forced into making a decision of, I can't afford to send their computer home. It's not going to work, but we can, if they use their computer or something like that, okay. But understand that's additional risk, and you need to make sure you know what that risk is and do the best that you can do to limit that exposure. Remember, if you're going to allow that person's computer to do work from home on that person's computer, you've just extended your corporate network to that person's computer. So you want to take every opportunity that you have to make sure that there are good protections in place to prevent things that happen on that person's local computer from interacting with things on your corporate network. Wi-Fi is, in many cases, the bane of my existence. It's great. A lot of people use it. It's beneficial. It has done things for us. But if you're depending on Wi-Fi at a person's house or at Starbucks or wherever for them to do their work, I can tell you you're setting yourself up for significant amounts of frustrations. So I would just encourage you to use Wi-Fi as little as possible, and where you can, take the cable and plug them into the network, plug them into the router or modem at home, into the router at home, or whatever the case is. Use Wi-Fi as little as possible when you're doing these work from home situations. You want to make sure that you're using VPN software, or in some cases hardware, because the VPN software is what encrypts that traffic and makes it secure to pass between that person's computer at home and your work network. And I say secure. Nothing is ever 100% secure, but the VPN will significantly reduce your risk. There is VPN hardware out there, but understand, if you're going to use VPN hardware, you've now just extended your corporate network into that person's house. And so you've set up a bunch of new regional offices for every employee that you send home. Understand what that looks like, and understand what your risks are. I'm not saying not to do it. I'm never going to say not to do it. Just make sure if you do decide to go that route, you know what your risks are, and you know how you can go about mitigating those risks. Talking about risks, you want to assess those risks early and often. And so as we were making the decision to start sending people home, I'm thinking immediately about, well, what do we need to do to increase logging and reporting? How do I make sure that the software is up to date? Well, a lot of those things we're already doing. We've got tools within our anti-malware systems that we use and firewall systems that we use that are going to report back to me if we've got sudden issues. Our security log and event monitoring is going to be able to report what's going on if we've got particular issues that come up. But this is one of those cases where you're going to make sure you're doing that right early, and you're going to check it often. So, I'm looking at firewall logs and risk indicators on a probably a couple, 3 times a day basis, just to make sure nothing is changing. Yeah, we're into this for a few weeks now, but I'm still just keeping an eye on everything, and I'm checking it pretty routinely. And that's why I'm saying I'm using the monitoring tools. We've got a third-party service that's helping us monitor these things as well, and we do that normal day-to-day as well. but we're using it even more now to monitor what's going on in our network now that we've extended it into everybody's homes. So a couple things that you want to think about as you send people out. Make sure you can and that you know how to remotely secure a device in the situation that becomes an emergency, i.e., you have a team member that unfortunately you need to promote them to customer status and move them out into the world and not your employee anymore. How do you secure their device? How do you make sure that when that interaction goes poorly, you can protect your network and protect your data? Can you remotely wipe a computer? Can you remotely secure that computer? How do you make sure that that's done in a time when you can't see that employee face to face? So those are all really important things that you want to make sure that you know how to do and employ on a pretty regular basis. I know Katie talked a lot about staff productivity, and I'm going to look at it from an IT perspective. You know, is what we're doing from an IT perspective to support these employees working? And so, you know, I'm routinely hearing from our billing folks that our employees are staying productive. If we're down in productivity, that entirely could not be an employee issue. It very well could be an IT issue. It could be the equipment that we've got. It could be a slow network connection. It could be any number of things. So I am absolutely depending on the billing staff to let me know if there are problems. And I want to make sure that we're doing everything that we can to make things productive for our staff at home. So that's another way you can do the right thing. So we had a few surprises along the way. And Katie mentioned it, and I'll mention it again. Not everybody has internet at home, which, you know, I had internet at home back before the internet had a capital I in front of it. And so to me, when they said, well, we don't have internet at home, I'm like, you don't? It was really interesting. And so we found that out along the way. And so we found some technology that we were able to deploy in those instances where the employee did not have internet at home, that essentially just isolated their equipment, plugged into this wireless router that you see on the picture here. They're working great. And I now have those employees working with their phones and their computers and everything are working from home just as if they were on the network, and they didn't even have internet in their home. So we were able to provide them with this equipment along the way, and it worked really well. One of the other surprises that we had, and Kate talked a lot about this as well, is that we had some employee members who did not necessarily have a safe environment at home. And so as we were working through, you know, who we were going to install, when we were going to get there, and where we were going to go, we worked very closely with the supervisors and managers in our billing office to say, you know, hey, we got a problem. This person's going to, you know, we're going to install this equipment at their mom's house because that's going to be a safe place for them to work. And we absolutely did that. But that's one of those things where along the way, it's like, oh, well, we need to make sure that that's taken care of. And so, in fact, we were able to install those in those places. And we wanted to make sure that those employees stay safe. So what did EMSA do to kind of pull this off? Well, we were able to move our entire staff, close to 40 some odd people, home over a period of about 48 hours. We made the decision on a Tuesday. We had them stay home on Wednesday, and we started doing installs in their homes on Thursday and finished it up Friday night. And so over a 48-hour period of time, the 6 of us in the IT department all took turns installing in folks' homes, and it really went very smoothly. We were able to do this because we had a flood back in 2013 where we had to completely evacuate our building. So be thinking about your disaster recovery plans, folks. Back in 2013, it really prepared us to be able to move everybody home on kind of a moment's notice for this event in 2020. We're fortunate to have a very virtualized environment. So every employee has a virtual desktop that they do all their work from, and just thin clients in their desks. And so we just said, here's your computer, here's 2 monitors, here's your keyboard, here's your mouse pad, and the necessary Post-it notes that were on their desk. Put them in a box, sent them home, and we got everybody set up. And as I mentioned, we had the wireless routers. And we're still, there's still a lot of manual stuff that's going on, some paperwork and everything, and we're handling a lot of that through scanners and email and doing that securely within our own environment. So we were really successful and very happy that we were able to pull it through in such a short period of time, and getting great reviews from our folks, and a lot of kudos to the IT team that actually made this happen on short notice. So with that, I think I'm gonna turn it over to Scott.
Excellent, excellent. Thanks, Frank and Katie. Great information from both of you. I can't thank you enough for agreeing to do this presentation with me. Just wanted to tackle some of the HR and legal implications of having or moving your workforce home. And for a lot of organizations, I've heard owners in the past say in management meetings, we don't allow people to work from home, or we don't have anybody who works from home, and half of the management team raises their eyebrows because they functionally work 24/7, even when they're home. So I wanted to quickly run through just some of the HR concerns or things that you want to be at least cognizant of as you're making the move. One, of course, a lot of us, this is probably not what we would have chosen for sure. But one of the things that we may learn, and I know Asbel Montez briefly talked about this when we had or did a presentation a couple of weeks ago, that he said that in their workplace, actually some of their productivity went up. Now, I know that I think he's probably referring principally to when it was done in a manner that wasn't as a result of a COVID or a coronavirus pandemic. And so, those are oftentimes instances in which, sort of the application of work from home was able to be rolled out in a timely fashion. And knowing what the folks over at EMSA went through and talking with their HR person prior to the webinar, from what I understand, what they pulled off and what the IT folks over at EMSA pulled off, and under Frank's guidance, really was nothing sort of shy of miraculous. So wanted to talk just about consistent application. I've gotten questions from a lot of folks about, and this is an area for which you need to be cautious, right? Which individuals, and Katie mentioned this, which individuals can work from home and which ones can't. And I think this is going to be probably a larger challenge as we start to get people back into the workplace following the work from home orders. But being sure that at least to the extent, as Katie mentioned, there are some functions that just cannot be done remotely. So making sure that as you lead into who can, and when I say who, not people, I mean positions. You're always safest when you talk position and not individual. So thinking about which job functions can work from home and which job functions cannot, regardless of who the individual who fills that job position. So making sure that you consistently apply those work from home policies. One of the other things that we often get are, can you please provide us with a set or a sample set of work from home policies? And I think in most instances when we forwarded over, and I know Asbel shared the Acadians work from home policy, and it really was truly one document plus an acknowledgement form for the equipment that was sent home with the employee for the purposes of doing the work. And people looked, or the sort of impression I got was that they were expecting a full set of second policies. I caution you against having an entirely separate set of work from home policies, because the idea or the concept is that while it may not be precisely the same as working in the office, many of the workplace norms need to still be complied with. And so establishing that to the extent that there are things that are so consistent or so representative of a work from home environment, that's fine, you can have a separate policy. But outside of that, I strongly suggest that you stick with having or keeping the same policies that you use in the workplace. One, presumably your employees are already knowledgeable and comfortable with that. But then two, it's easy from the perspective of management to make sure that we're remaining consistent. Of course, there are some legal implications here when it comes to work equipment and expenses. And generally speaking, an employer cannot require an employee to bear the expense associated with having to work at home. And so, as Frank mentioned, he thinks the best practice is providing the employee with the equipment. And I agree. I think when you provide the employee with the equipment, you have the ability, the greatest ability to not only control for quality of work and hopefully consistency of functionality, but then also you're ensuring that they're not bearing expense as a result of working from home that they should not legally be required to bear. The other thing, ensuring that when you do issue equipment, and I know most folks already do this, but having an acknowledgement form that the employee signs off on to just at least as a receipt of receiving the equipment and understanding the terms and uses of the equipment. So often we will have terms of uses of equipment when they're in the workplace. My strong suggestion would be, right, if you are sending equipment home, that this equipment is to be used for work purposes only, not for surfing the web after work hours, etc. For the most part, with the exception of the few folks that Frank mentioned that may not have had internet at home, for the most part, most of our employees already have some level of technology in their home. And so being sure to make sure that they keep a firewall between what they're doing on the work systems versus what they're doing on their own personal systems. And then Katie briefly talked about insurance coverage, and in a couple of slides we're going to talk a little bit about workers' comp, but being sure that you take a look at your that you look at any of your policies, not only your liability policies, your workers' comp policies, but then in addition, any other E&O policies, etc. You want to make sure, especially your cybersecurity policy, you want to make sure that those policies provide and don't specifically exclude certain things in certain events. So it's important that you engage your either your own legal counsel or your broker, and I promise you they will be taking numerous phone calls right now about this very issue. So probably the largest or the biggest issue, and I see our first question coming in, and one of the things that I will tell you is we're going to wait for questions and we'll answer them all at the end, but please do continue to use that Q&A box in the Zoom platform. So wage and hour issues are probably the area with which employers run into the biggest challenge when they come into a work from home situation. So being consistent with working times. Katie mentioned a little bit about accommodating the ability to shift work times so that either, you may need to do so for purposes of, work traffic on your network. You may need to for accommodating individuals with childcare and their ability, because as you know, under some of the leaves that were passed as a result of the Families First Coronavirus Response Act, there's the ability to work or telework. So recognizing that to the extent that you establish work hours, is setting expectations with your folks, as both Katie and Frank talked about, but establishing work times for your folks, making sure who knows who's working which times and who's not working which times. And we'll talk a little bit about allowing employees to unplug when they're not working, making sure that the timekeeping mechanisms or devices that you use when they're in the workplace either function when they're outside of the workplace, or that you have come up with a contingent plan to ensure and recognize and track time. By far, probably the greatest exposure outside of the technology, possibly protected health cyber risk issue, are the wage and hour complaint issues. And in most states, wage and hour complaints carry with them treble damages plus attorney's fees. So it's not just the wage that may or may not have gotten paid correctly, it's 3 times the wage that didn't get paid correctly, plus whatever fees any attorney's fees. So making sure that your timekeeping processes work, making sure that they work, again, remotely, making sure that you are very clear with your folks about abiding by meals and break times, right? Recognizing that they're not working through meals and break times. You should be auditing from time to time to make sure that to the extent that your folks are in fact taking their break times, and that they're either punching in or out as required, if it's a break in which they have to punch out, but otherwise making sure that they are taking those times, because in many states there are very strict break times, and often because of EMS organizations where break times can be, where some of the rules may not apply to field employees, we lose sight of the fact that our administrative staff, those laws are, do not provide any exemptions for our administrative staff. The other issues are making sure that they keep to those time off requests, right? If someone needs to request, if they, for example, have family medical leave not associated with the emergency leave, but have sort of all of those things that impact our workplace on a daily basis from the perspective of time off, whether it's intermittent family medical leave, whether it's sick time or other vacation times, making sure that that process still remains intact, the process for both requesting the time, approving that time, and then tracking that time. So being sure to do that as well. And then again, if for whatever reason your employee reports to their home office, and I'm using air quotations, which is foolish because you can't see me, but if they report to work, and for whatever reason, something outside of their control, but really within your control, they can't work, making sure that you recognize that there are some reporting pay requirements in many of the states that our members operate in. So the wage and hour issues are probably, to me, next to the cyber risk, the number one most problematic area for folks in working from home. And as we said, if you're a AAA member, you're on the webinar, you always know that you have access. I've been an employment attorney now for 17 years. And so I'm happy to help you work through some of those issues. Working from home from a work injury perspective, I often get asked, are we responsible if, to do an inspection of an employee's home, or if an employee gets injured at home? And by and large, it really depends. OSHA does not do home inspections and do not require that employers do home inspections. What they do require of an employer, of course, is that they provide a workplace that is free from recognized hazards, right? And so what I would suggest for folks are to the extent that there are some knowable or reasonably foreseeable hazards in an individual's workplace at their home. So if you're one of Frank's team and you're in the house installing the equipment, and there are things that are clearly recognizable hazards, right? Hopefully, and I'm sure Frank's folks aren't plugging 7,000 things into one power strip, but to the extent that there are reasonably foreseeable hazards, the employer is responsible for those. Not if you trip over if your employee trips over their child's toy in the living room. That would not really be a work-related injury. But to the extent that an employee gets carpal tunnel syndrome, or any one of those other injuries that occur as a result or in the performance of their duties, those would still be ones that you would want your employees following your typical standard employee work injury reporting. Making sure, of course, that the equipment that they're utilizing is safe. If you are bringing in any workstations or chairs, making sure, of course, that they weren't damaged during transport to your employee's home, and then being sure to maintain your recording and tracking of injuries as you normally would, right? So being sure to have them fill out the first report of injury, and making sure that you're tracking those on your work injury logs. So disability accommodation. So there's a few important pieces that you need to consider when moving your workforce to a remote, or whenever you have someone working remotely. To the extent that you have provided some type of accommodation to an employee when they're working in the workplace at your work location, you are still required to provide an accommodation, that same accommodation, or potentially a different or greater accommodation when you move them to a remote workplace. So for example, if they have, because of possibly eyesight issues, they have a special monitor reader, or they have a special, because of hearing issues, they have a special amplifier for any phone system, you would still be required to provide that. Now, if it turns out that at your office, there are some accommodations that you may not even recognize that there's an issue because of, let's say you have, 40-inch screens for your employees, but when they come home to a small worktop or a laptop screen, that because of a vision or potentially a vision related disability, they aren't able to read. You would then want to go through the interactive process, which in some states you must document that interactive process. But the important thing is engage the employee, get into that interactive process, which is just a back and forth of what can we do to help you perform the essential functions of this job. You're not required to give every single accommodation that they request, only those that are reasonable and that don't create an undue hardship. An undue hardship under the ADA is generally something that involves great expense or great difficulty. So that can include stuff like, for some employees, additional break times. If you have employees who are diabetic and need to take medicine or to have additional meal breaks due to their diabetes, or if you have someone who's pregnant or post-pregnancy after delivery needs to take additional nursing breaks, then you would need to permit them to do that. If there are specific equipment and tools, again, you'd want to go through that interactive process. If it's something that is so incredibly expensive, you couldn't provide it, you need to still look for what might be a reasonable alternative. So document, as I've heard multiple times on from my co-presenters today. Document. And in some states, as I say, there is a requirement that you document that interactive process. So it's whether you knew or actually know they have a disability or perceive them to have a disability that you would want to engage in that process. So just a few other HR considerations before we wind it up and then start to answer the few questions that I've seen come up. One of the things, the Society for Human Resource Management did a survey recently, in fact, it was just published last week, about some of the difficulties that employees are finding when they're working from home during this COVID emergency. And one of them is that they're really finding it hard to unplug. So, finding it hard to unplug and really setting parameters. This goes back to being very clear about the expectations and setting work hours. Because while I know this provides some flexibility where you may be able to stretch your day out a little bit because you have to interrupt it with caring for children or pets or other things, it's important to recognize that to the extent possible, keep your employees on a schedule. And when they're off work, right, and you're doing your audit to make sure that, because there are ways, if an employee has punched out, and I've found this before, where I've walked by a billing office and seen an employee after hours working, and when I asked them, they said, well, I punched out and I just needed to get this done. That's not permissible, right? You need to pay that employee and make sure that they understand what the expectations are. In this instance, you'd want to make sure you're doing some compliance runs to make sure that you don't have people accessing the system after hours that they're not supposed to be on. But again, there's a great way to put this, and it's, we want you to be able to spend time with your family. Maybe you're spending too much right now, but when you're not working, don't work, please. Encourage that balance. Go out and do other things. Recognize from the perspective of performance and setting performance metrics that this is not your typical situation, as Frank mentioned, right? This is not going to be a typical or normal situation as it relates to your work performance. So there are going to be additional work interruptions, on video chats, etc. But it's fair for you to expect that people will comply with workplace norms to the extent possible. Increased stress. One of the things that we've been talking a lot about, and we're doing a webinar at 4 o'clock this afternoon with Dr. Rock and Randy Strozik, we talk a lot about is the mental health stressors that employers are feeling. We know with frontline employees that we recognize kind of where that stress is coming, but recognize that for your remote working employees, that stress exists as well. So prioritize communications. Just because it's convenient for you to send an email after hours does not mean that your employee who might be having a hard time unplugged wants to get that webinar after hours. So to the extent that you can, prioritize your communications and communicate by email when you have to. And as Katie said, to the extent that you can, I think checking in with your employees at the beginning or end of a week, face-to-face, either through video chat or by over the phone, is a great idea. In fact, I think it's one of those that will pay dividends. So I want to pass this back to Katie before we wind it up, because Katie, this is one of the slides that Katie had put together, and I think Given how wonderfully she really captured the first part, Katie, if it's okay, I'd like to pass this back, and then I'll moderate questions following this slide, if that works.
Yep, that works. So, what happens after what is today? Because it's gonna go back at some point, but it's not gonna go back the same. So, just remembering that this is gonna pass. We don't know when it's gonna pass, but it will. So, look back on what are lessons that were learned, during this. Was this a trial period for you? Can this turn into a permanent solution for you? What worked well and, what didn't work well. Frank did a good job of talking about how, we're trying to prioritize technology issues that we're experiencing because it could be affecting productivity. It could be affecting their overall, mental health. Nothing is worse than trying to open up a system and it won't open. So, for us, some wins that we've experienced is, reduced paper, better work-life balance. Once they get the hang of it, and they understand that, work is when you're present and you're clocked in. But after that, it gives them that opportunity to save time in their commute. And also for me, I've been doing remote work with our associates now, I think for 4 years. And I do not have to manage as much PTO use anymore. They have a lot of flexibility within it, within those remote schedules. So for me, that was a huge admin win. And I think it's important to recognize that, remote work isn't going to be for everyone. And I think it'll be honestly less appealing after the orders are lifted, because you kind of always want what you can't have. For me personally, I never thought that I'd be so excited to show up to a 3-hour soccer tournament at 7 o'clock in the morning on a Saturday, but all of a sudden now, I'm looking forward to that. So, but that's short term, that feeling will subside. If you require them to come back into the office full time, all the time, they're going to ask the question of, well, why do I need to be here? And you need to be ready to answer that. And again, this is completely organizational specific. It's up to you what you feel is best. But, look at, can you be flexible with either remote and in-office schedule, or can you be flexible with them if they want to just be fully remote? So,
Katie, one of the questions we got asked, I think folks liked your snack drawer idea, if you wouldn't mind providing 1 or 2 examples of the tasks that you include in a snack drawer.
Yeah, absolutely. So the snack drawer concept really, it's usually payers that have smaller amounts of claims that kind of get stuck, they kind of get hidden because their dollar amounts are so small, you don't recognize when their aging is creeping. So a lot of times it'll be like a facility, maybe it's a hospice, maybe it's a non-participating payer, maybe it's a workflow, so claims are on hold because they're waiting for attachments. Just having someone go back in and see if those are attachments, that PCS form is there now, and then getting that claim out the door. So that's just a couple examples of our snack drawer.
That's a great suggestion. It's one of the notes that I took during the webinar. So another question we got was essentially, how do we deal with or handle staff who work remotely who have babies or toddlers, and can we require that they use daycare? And sort of how to approach that. So I certainly have a perspective from legal, but I would love to hear if you had to, either one of you had to deal with that in your organizations.
Yeah, we're dealing with that right now. I think it's important to recognize that there's today, while we're dealing with this pandemic and what that brings. For us in Michigan, there's no school for the rest of the year. Everything's remote learning. Daycares have not been permitted to reopen unless they're considered like essential workers. So, we've had some folks that have, we've provided that, they're still expected to work. They're still considered essential. So they've been able to get into daycare centers. But right now, it's really looking at what's the current situation today. Can you flex with the work that they're doing? And if you can, allowing that, but knowing that it's clearly documented what the expectation is of when they're, going to work or what their output's going to be during that time. And then I think after we get through, this current pandemic and things start to open back up again, for me personally, for us, we want to see that when they're working, they're still having the same output. And so if that means you need to have childcare to do that, then that's what it would be expected. So.
Well,
I want to add something that's along the same lines, slightly different. But we had one of our team members who did not have internet at home that we put the wireless router in, had a child who was needing to attend school remotely and would not normally have had internet to do that. And she asked, could we use the internet that the company provided for the purpose of my child going to school? Fortunately, the way that we set those wireless routers up at people's homes, that was not going to be an issue, because there's no way that their traffic could touch any of our network traffic. And so I felt like that was an absolutely reasonable thing to do in this situation to take care of that employee.
I think that's actually a great suggestion, right? You're creating an opportunity for employee that they wouldn't otherwise have had, and so actually they yield an additional benefit. But I would imagine, again, talking about the security piece and using company equipment, right? You would want to make sure that the parameters under which that use would be very clearly drafted.
Yeah, we made it very clear to that team member that said, his needing to go to school can in no way interfere with your ability to do your work, which we set it up. It wasn't going to be a problem, but we did make that clear as we answered that question.
So one of the other pieces to the toddler question that I wanted to just touch base on was, to the extent that your organization has decided that it will not exempt either your field employees or your organizational employees from the emergency leaves under the FFCRA, the Families First Coronavirus Response Act, then the way generally employees are entitled to the leave if they can't work or telework. Now, if because they have a toddler or a baby, and if you've ever had a toddler or baby, you know that it can be very, very challenging to try and work productively at home. In that instance, then, of course, if you had not excluded them from the category of folks who would be eligible for that leave, then you would need to provide them with the leave because this would qualify as home care. Now, if they had other available childcare, then you could certainly work with them. But this would be one of those situations where I would strongly suggest that you engage that employee, again, very much like the disability discussion, in an interactive process. So one last question, and then we'll wind it up. And it's, how do we handle having to cut back staff hours if the employee does not wish to use accrued PTO for non-work hours? So I'm guessing the non-work hours meaning in the reduction in hours. So, Katie, I don't know if you have any suggestions on that, but I can certainly tell you from an HR perspective, you would want to be sure that you're consistently, you understand which positions that you are going to be doing the reduction in workforce or reduction in hours, that you were applying your policies consistently, making sure that if in fact you are going to reduce the hours of some employees and not others, that there's a very clear criteria for how that decision is made. And then, of course, in most states, or in many states, there are what are called work share programs, which permit you to, rather than laying off one person at 40 hours, you can reduce the hours of, let's say, 4 people 10 hours a week, and they can file unemployment for those lost hours. Okay, I don't know if Katie or Frank, you have anything to add to that.
I don't.
Okay. Well, one of the last things, and it's a great suggestion, our communications chair, Rob Lawrence, suggested yesterday when we were on the phone, is really strongly suggest for people that you start your after action report now. In other words, we've all been to large scale events or dealt with large scale incidents in which, afterwards we try to sit down and say what went well and what didn't go so well. And to me, this was an epiphany, and I've done, CAS related stuff where we talk about doing after action reports, but Rob said, start that report now. Really start while it's fresh, because one, the span of this event is so long that we are going to forget what we did well and what didn't work out so well. And so Rob said that he has a whiteboard that he has already started documenting, you know, what did we do well, what didn't we do so well, what were challenges we hadn't expected. So just really, truly, strongly suggest, and I think it's an excellent suggestion, that that you do that. For those of you, so we're going to wind it up because we're running over, and I'm so sorry. I do respect your time, but I didn't want to cut anybody short. You know, we of course have the AAA has plenty of resources and information available to any of the listeners here on here, and of course always for our members at this URL below, ambulance report, ambulance report, like I'm doing cost reporting, ambulance.org. You'll see the bright yellow COVID tag, pardon me, and you can get all the information. There's plenty of resources there. Other than that, I would like to thank you all. Of course, we have another webinar coming up in just about 2 hours with Dr. Ed Rock and Randy Strozix, and myself, where we'll be talking about some of the clinical perspectives as well as dealing with how do we start to bring people back to work following an exposure or the actual illness. So with that, I will hand it back over to Peter just for the closing comments. I think he will be sending out a survey. Peter?
Thank you, Scott. Yes, for everyone still in attendance, the slides and the recording of this webinar will be sent out probably by the end of the day. So keep an eye out for that. And if you have any further questions, comments, or concerns, feel free to reach out to the AAA at info@ambulance.org, and we'll get back to you as soon as we can. So thank you, everybody.